Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care, so that you can have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. In last week's blog, I talked about the second part of the IntensiveCareHotline.com 3-part mini-series, Critical Lessons for Families of Critically Ill Patients in Intensive Care, Part 2, where I talked about what's happening behind the scenes in intensive care is way too powerful to not impact on your critically ill loved one. You can check out last week's blog by clicking on the link below this video. In this week's third and final part of the IntensiveCareHotline.com 3-part mini-series, I want to continue with Part 3 of Critical Lessons for Families of Critically Ill Patients in Intensive Care, Part 3. In Part 3, which is also the last part of the IntensiveCareHotline.com mini-series, I want to hone in on what you see is not always what you get in intensive care, and that's why you are the best advocate for your critically ill loved one. So why do I do this IntensiveCareHotline.com 3-part mini-series? I do that because I learned and still learn many valuable lessons after more than 15 years intensive care nursing in 3 different countries, where I literally worked with thousands of critically ill patients and their families. I have also worked as a nurse unit manager in intensive care for more than 5 years, and I have learned so many lessons. I have seen so many things happening behind the scenes in intensive care. I have seen so many families in intensive care suffer that I really feel an obligation to share my intimate knowledge with families of critically ill patients in intensive care. But before I get into today's topic, I want to share a quote with you that I wrote on today's topic, and the quote says, "You've heard of the expression, what you see is what you get. However, most of the time you don't see what you get when your loved one is critically ill in intensive care." Intensive care is such a volatile, ever-changing, dynamic, and also highly political environment that if you don't read between the lines, if you don't ask the right questions, if you don't stand your ground, and if you don't challenge the intensive care team's assumptions as well as their perceptions, you'll end up with no peace of mind, no control, no power, and no influence. The stakes are very high in intensive care, and your critically ill loved one's diagnosis, their prognosis, as well as the care and treatment offered or not offered, is often framed in a light that suits the intensive care team and their agenda. If you have a loved one critically ill in intensive care, and if you put your trust in the intensive care team blindly, you will most likely feel that what you see is what you get. However, if you are dealing with this once-in-a-lifetime challenge with your eyes wide open, ready to challenge the status quo of the perceived power and the perceived authority of the intensive care team, you will very quickly find that what you see is not always what you get. It's therefore that you shouldn't follow mainstream or society's opinion, who wrongly conditioned you to follow the lead of intensive care teams and doctors in general, but rather do your own research, start asking the right questions and be your critically ill loved one's best and only advocate. Advocacy for a loved one, especially if they are critically ill and in a potentially life-threatening situation, should never be delegated to a third party. The only people who have your loved one's genuine best interests at heart are you and your family, period. Delegate advocacy to intensive care teams and you'll end up like 99% of the families of critically ill patients in intensive care, and you'll have no peace of mind, no control, no power and no influence. Take matters into your own hands and chances are that you will get what you want and you'll have peace of mind, control, power and influence. So, let's dive into part 3 of the IntensiveCareHotline.com 3-part mini-series and let's look at today's topic. What you see is not always what you get in intensive care, and that's why you are the best advocate for your critically ill loved one. When your loved one is critically ill in intensive care, the scene is set. The intensive care team knows what to say, they know how to say it, they know when to say it, and they know what not to say. Intensive care teams are managing families of critically ill patients in intensive care 24 hours a day, 365 days a year, day in and day out, year in and year out. And on top of managing you and your family, they're also looking after your critically ill loved one. And that's not everything. They also have to manage scarce, expensive and in-demand intensive care beds and resources. They have to manage the expectations of hospital and intensive care management, and those expectations are usually of financial nature and have nothing to do with patient or family satisfaction or well-being. They also have to manage something that's probably even more surprising to you. They have to manage their medical research interests. Medical research in intensive care is massive, and usually millions and sometimes tens of millions of dollars are being spent on medical research studies per year in an intensive care unit. This is an area that you probably don't know enough about. However, you need to understand that whenever there are millions of dollars of funding involved, interests and alliances can shift very rapidly at the expense of truth and transparency. What you need to know about medical research in intensive care is that certain patients in intensive care may fit the medical research criteria and others simply don't. It's that simple. The ones that fit medical research criteria have a price tag attached to them, if you will. And the ones that don't fit medical research criteria simply don't. It's that easy. Therefore, conflict of interest situations may arise rapidly in the name of science and academia. And as I have said before, the stakes in intensive care are very high. They're very high for you, for your family, and most of all, for your critically ill loved one. But given that you are here and you are expanding your knowledge about intensive care rapidly, you have seen by now that the stakes are pretty high for intensive care teams as well. And if you are still here and watching this, you know this to be true. Otherwise, you wouldn't be here watching this. You know by now that what you see is not what you get in intensive care. You know by now that if your critically ill loved one is in one of the following difficult, challenging, and often heartbreaking situations, such as when they are very unstable and in a very critical condition, or in a life-threatening situation. Or your loved one may be in an induced coma and isn't waking up. Your loved one may be in intensive care for long-term treatments and long-term stays, including long-term ventilation. Or your loved one may be having a severe or traumatic head or brain injury. Or even worse, your loved one may be threatened with an NFR, not for resuscitation, or DNR, do not resuscitate order. Or your loved one may be in a situation where the intensive care team suggests a withdrawal of treatment or a limitation of treatment as being, quote unquote, in the best interest for your critically ill loved one. Or your critically ill loved one may even be approaching the end of life in intensive care. You need to know that in those situations, your critically ill loved one needs a lot more than an intensive care team looking after them. You know by now that the complex and volatile nature of intensive care, with the many things happening behind the scenes in intensive care, as well as the intensive care team often pursuing a strategy where they are trying to, quote unquote, sell you and your family as being, quote unquote, in the best interest for your critically ill loved one, often don't match up. You also know by now that the intensive care team may present to you, to your family, and to your critically ill loved one things and situations in a way that cements their, quote unquote, expert status, their perceived power, and their perceived authority. They may be overtly using their medical jargon, and they may be telling you that you don't understand, or they may be telling you it's too difficult to explain, further putting themselves on a pedestal of perceived power and perceived authority. And if you and your family are like 99% of the families of critically ill patients in intensive care who don't have peace of mind, don't have power, don't have control, and don't have influence, you buy into the perceived power and the perceived authority of the intensive care team, and you don't question. However, if you are still watching this, I know for a fact that you know the only way you can become a master of your own, as well as the master of your critically ill loved one's fate and destiny, is by you taking action and by not sitting on the sidelines. You know that it's time to take action and discover the things that you need to discover. You know that it's time to start asking the right questions, and you know that it's time to challenge the status quo, the perceived power and the perceived authority of the intensive care team to get what you want. You know by now that the only way to get what you want is by going against the grain, going against what society has wrongly taught everyday people for centuries to listen to doctors and intensive care teams. You know by now that 99% of the families in intensive care have no peace of mind, no control, no power, and no influence, and you know they are lacking the grit and the determination to get what they want. But you are of a different caliber. You know that, and you know what you want. You are prepared to stand up for yourself and your beliefs, and most of all, for your critically ill loved one in such a vulnerable situation, and you know that. So, how can you become the best advocate for your critically ill loved one, and how can you get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to peace of mind, control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care, and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's blog, and I'll see you again in another update next week. Make sure you also check out our Your Questions Answered section, where I answer your questions, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me. Find our international phone numbers on our contacts tab. Also, check out our ebook section, where you get more ebooks, videos and audio recordings, and where you can also get one-on-one consulting with me via Skype or over the phone, and via email by clicking on the email and phone consulting tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.